The children 5 to 11-year-old age group get sick from COVID. The majority of children in this age group who get COVID have no symptoms. And of those who get symptoms, the majority have very mild symptoms. So yes, there are many children out there who have gotten COVID and have very mild symptoms. But it is not accurate to say that children in this age group cannot get severe symptoms. They can, it just happens at a much lower rate or frequency than an older person. The rate of children in this age group needing to be hospitalized from COVID is 1 in 200. So yes, 199 children who get COVID do fine, but there are children who get hospitalized, luckily at a low rate. Of those children who are hospitalized, about a third of them have the severe illness that is called MIS-C. And this illness is where a child presents 1 to 2 months after being infected with COVID. They may have never had symptoms. They may not have even been tested because they didn't have symptoms, but then they come in very, very sick with a sudden onset of fever, sometimes vomiting, diarrhea, rash, and these children come in noticeably ill when they come into the hospital. This is a severe complication that affects the heart, which is why COVID can be more dangerous to a child's heart than the vaccine because of this rare condition. It's the 5 to 11-year-old age group that have the highest rates of this MIS-C, and through October, there are 94 deaths across the US in this age group. So again, put in perspective, 94 deaths out of at least 2 million children is very, very rare. The vaccine for 5 to 11 years old has an emergency use authorization, so it does not have full approval yet, and it is recommended for any children 5 to 11 years old. It is a smaller dose than the 12 and older dose. It is 1/3 the dose, so it is a different vial. Anybody 5 to 11 gets only the 10 microgram dose. And the reason is, it is because the smaller dose was shown to have less side effects, but work just as well. And that's because children's immune systems are more active and they respond better. The common side effects were sore arm of the 5 to 11-year-old group and were a little bit of headache, some fatigue. After dose 2, we know kids can get a little more reaction, sometimes fever, but these were all very milder than they were for adults. And then importantly, there have been no severe reactions. There were no cases of anaphylaxis, the severe allergic reaction, no cases of myocarditis, which is the inflammation of the heart. Please reach out to us if you have any questions about the COVID-19 vaccine. We UPAC community health workers can assist you in transportation or scheduling. Thank you so much.